Hello, everyone, and welcome back to DecodeMD, where we explore the stories, struggles, and successes behind the life in medicine. I'm your host, Dr. Pranav Joshi, and today we have with us Dr. Ratnali Gandhi, whose journey beautifully captures the clarity and confidence it takes to carve your path in medicine. From choosing MBBS to pursuing diploma in ophthalmology, she has navigated a series of tough academic and career decisions that many young doctors face after the MBBS. So today we will decode her journey from NEET PG rank to college selection and what lies ahead after the diploma. Hi, Dr. Ratnali, how are you?
Fine, hello.
As you know, we'll be covering your journey in this session. We'll be beginning from the very early phase of your journey, from the starting of your MBBS. So tell me what inspired you to pursue MBBS. Like, was it your decision, or was your parents convinced you to do this? How did you join MBBS?
Basically, I belong from a doctor's family. My parents and both my siblings and sister-in-law are doctors. So I've been brought up in that environment. I have no clue about the professions, to be very clear. Looked up to them. I have grown looking up to them. It was always my choice. My mind was always been sculpted in that way only. So it was always I'll be doctor in some time. That was the only thing I had in mind.
Okay. During your MBBS period, when did you catch your interest for ophthalmology? ये starting से ही था like
So, to be very frank, uh, I was a blank slate. Like, I kept my mind very blank. I didn't have presumptions about any branch or this branch is good for me, this is not good for me. I was always open for options from the day one itself. Whether it is clinical, whether it is non clinical, paraclinical, whatever it is, medical, surgical, I always had an open approach to each and every subject. I explored that subject, I gave time to that subject because in UG, unless and until you have clinical exposure, you do not develop any interest.
definitely.
You do not get that zeal to, I want to treat this, I want to follow up these patients. This you will feel when you'll get that exposure. So by the time I came to internship, none of the subject was like, wow, I'll do my post graduation in this and I'll take my profession into this. But at internship, yes, I had exposure of ophthalmology, but at that time also, I had kept all my subjects in one level. None was above, none was below. So that was my
Okay.
open approach.
Okay. Have you always considered to do your post graduation, or या ऐसा था कि even if you don't get your post graduation, you would have been fine with it?
No, no. I always had in my mind, see, I have MD medicine, MS ortho, pediatrics, and ophthalmology in my home itself. So
Okay.
my vision was always bigger and brighter, I would say. I'm very lucky, I would say, that I had that opportunity or this exposure at home itself so that I can dream big. So I always had in my mind that I have to do post graduation eventually.
That's wonderful. I mean, everyone should have this clarity at least, because majority of the people, like, I feel they go into post graduation because of the rat race, and after that they feel stuck and they have to resign. So if you are willing to do post graduation, be it diploma, DNB, MD, MS, then only I feel like one should go for post graduation, isn't it?
Yeah, that's true. And looking in others' plate, see, each and everyone has their plate full of happiness and sorrowness, which they do have. You have to decide like what you want in your plate and what kind of life you want to lead. So it was pretty easy for me that I want to do a post graduation.
Exactly. Okay. So, tell me, how was your transition post MBBS when you were deciding to get into the branch? Like, say, before NEET PG only, when you started preparing for NEET PG, how was your transition during that period? And like after NEET PG, whenever you finally decided that you want to do ophthalmology, how was the transition?
So yes, the transition was like it was very different, very different. What I had imagined about ophthalmology and getting into ophthalmology are two very different things. We
Mhm.
say that for work-life balance and there is ophthalmology is a chill branch, but coming into residency and looking at like what n number of things I have in ophthalmology. So it is not that chill of a branch. Yeah, I agree. One of the pros is that eventually in life you'll get a work life balance, a good work life balance, because ophthalmology has very less emergency cases. You don't have to go on in night 3 o'clock, 2 o'clock and run behind the patients unless and until it is a trauma and some other things. But Rather than that, in residency, ophthalmology is hectic. Transition was different for me because in medical college where I did my UG in Pune, we used to see that in one day they used to have their OPD days. The next day they used to do their OTs, and the other day was for their ward day. Like this, their rotations were. But being in DNB diploma and in a DNB institute, they do recruit their patients on the same day. They do workup on the same day, and the patients are also operated on the same day. So you have ward duty also on the same day.
Okay, nice.
So
So,
it's quite hectic, but it's fun.
okay, nice. I mean, obviously, if you have joined the department knowing full well कि you want to do it, तो चाहे कितना भी hectic हो, I feel like you will enjoy the
Yeah.
process. Okay. Moving on, let's go on to your NEET PG journey.
Okay.
During your NEET PG preparation, how you approached your preparation and how was your consistency? And could you share a bit about your journey?
Okay. So I've prepared from Marrow and dance. I did my dance test series and I had joined Marrow and I used to give tests every 2 to 3 weeks. Yes, consistency is a key. A lot of part also depends on what you do on that exam day. You prepare your 100%, but you go and if it's not your day, it's not going to happen. So,
Exactly.
whatever is in your hand, do it and just wait what your result comes and accept it. The only thing I would say.
Sure. वो जो 3 घंटे रहते हैं, those are the crucial period.
Yeah. How you handle the situation in that moment of time, the amount of nervousness you have, the concentration and everything. There are n number of factors when you enter the exam hall. So if it's your day, it will go well. If it's not your day, it will get affected.
Obviously, obviously. Okay. Do you mind sharing your NEET PG rank and like how did it influence your choice between your degree and other diploma courses?
Yeah. So my rank was around 40,000. I was very practical in choosing the branch and what I'll get. I still remember the result came out at around 9 p.m. or 10 p.m. Rather than cribbing about my result, I just had a practical approach that what options do I have in my hand. One thing I was very clear about is I didn't want to go for deemed institute. That was my personal choice. Rather, so I just gave choice for I streamlined for semi-government and DNB and DNB diploma. So DNB I wouldn't have got like I would have got pathology, but I was more concerned about a clinical branch. I didn't want a paraclinical branch. So I had some limited amount of options. From that I chose that what I wanted to do.
Okay, so you didn't want to do DNB in paraclinical or just like the paraclinical?
I didn't want to go for paraclinical branch.
Was there any specific reason behind that, or was just your personal choice?
The specific reason was I love interacting with patients. I need that satisfaction of treating a patient. That gives me more pleasure in doing day-to-day practice. And also, the branch will be for whole life. So,
Exactly.
keeping that in mind, I chose my branch.
That is very good approach actually. I have seen a lot of people who have gone into paraclinical branch without considering that how they want their life to end up like. So after choosing paraclinical, they end up reattempting NEET PG again and again, and they end up wasting their residency period as well, and they don't go anywhere basically. So this clarity is very much needed. What advice would you give to aspirants on handling results and marking informed choices during NEET PG?
First of all, whenever your result comes, be happy in what you have got. Just sit back and pat your back once that you have come along through this. There is much competition and that you have gone through that. That is enough. You have done enough. Now your result is not going to change. Be very practical. Sit back and decide what options do you have. Have an approach that what I can do and I want to do. Don't go in that rat race that what my batchmate is getting, what my friend is getting. What you want to do is very important. Maybe he might handle emergency cases and a hectic life better than you, and you need a work life balance, or vice versa. So you should put that things in your list and then choose your branch. Just don't confuse yourself about no, this branch is very nice, no, this branch seems to be very nice. This gives a good income. My friend is taking this branch. Do not get into that. Just sit back and think down the line, 10 years down, what I want to do, where do I see myself? Go through that and then decide what you want to do.
Definitely. Yeah. One more thing that I would like to add into this is like few times people end up going after the college. If they want to do clinical and they're getting any clinical branch, let's say in a premier institute, let's say in Delhi or other central university, so they end up going after the college and they end up compromising with the branches. So that is not a good approach, I would say. People should go after their branch, be it even if they're getting not a, if they're not getting a good college.
Yeah, that's true because this is a matter of 3 years. After that, the degree will stay with you, not the destination or the place you're doing it from. The patient will not ask you, like, where did you do it from? He'll just see your clinical skills. How different are you from other doctors, other practitioners? This is what he will see. So, do not see that 3 year period like I want to do in this city. Yes, it is important in terms of like how far you want to go, like from your hometown. Comfort do you have? How if you are homesick, then do not try anything else, like be near to your hometown. Not everybody are comfortable in going so far, leaving the state. It's different to leave a state and stay. I am from Maharashtra and doing my PG from Banaras. It is different. It is a nice experience, but everyone should take that in mind, like they comfortable, are they homesick? Because it is matter of 3 years, 2 years. It is not just 2 or 3 months that you have gone and you'll come back. Because your residency is going to be hectic. Everything is going to be tested. So if you're that strong or you're not, just assess it yourself and then decide.
Exactly. I mean, even just today, one student had messaged me on Insta asking me ki where should he get his pharmacology from. He's getting multiple options, BHU, Gujarat, Maharashtra. But the guy is from Gujarat and he's a little homesick. So I advised him to like get it done from Gujarat only, obviously. Okay, moving on. Were there any other branches you considered before finalizing ophthalmology?
Yes. Looking at my rank, I had three options. And the NBA diploma offered, and what my rank I would have got were three branches: ENT, Ophtha, and anesthesia.
Okay.
So these were the three branches I had option for. I didn't go for anesthesia because again, love to interact with patients. It is kind of branch which does not allow that much interaction. So I was not comfortable taking that branch. Again, anesthesia also has emergencies. You have to go at night. Whenever the call comes, you have to attend that. So I didn't want to go for that branch. Then left with ENT and Ophtha. I had an extra edge for Ophtha. So I went for Ophtha.
Okay. Okay, tell me what are some good colleges in India that are offering diploma in ophthalmology students should look out for?
I would say there are n number of colleges. There will be added n number of colleges will be added every year. So basically, you just see the institute which has, especially for off I'm speaking. The reason behind me doing DNB diploma is NB accredited places do have DNB institutes do have nice the latest machineries. And Ophtha is all about latest technologies. Every 5 years, there'll be new technology and you'll have to be updated about it. So that institute should have all the latest technologies. That is what I saw in my institute. Do not go for college reputation and everything. First, see what exposure you are getting over there. What surgical approach is one part, it is just one part. You should also see the academic exposure you are getting, the clinical exposure, the number of cases they are seeing. That is what matters. So, whenever you select an institute, I would say just call up a resident over there and talk to him or her and then get an idea that what amount of cases you see. And like it is not important to see one patient 100 times. It is important to see the spectra of patients. You should see n number of patients. Like in my institute, we have different departments: the cornea, retina, glaucoma, and cataract. So our postings are likewise. So I get exposure of each and every specialty. So that is what is important. You should see in an institute that what you are getting, what kind of exposure you are getting.
Okay. Could you share insights on the typical NEET PG cutoff rank for diploma in ophthalmology in government versus private colleges?
Diploma in ophthalmology, I would say you should only go for NB accredited diploma, not any private diploma. I think the private diploma is cancelled also. There are no seats of private diploma right now. And if they are there, then do not go for it. Go for the NB accredited diploma. You'll get opportunities more. And cutoff, I would say it is very unpredictable. Every year the competition is different. For that you have counseling and everything. You go for it and then see what was last year's cutoff, and about 3 to 4,000 above and below plus minus you'll get that seat.
Okay, no worries. So there's often a perception that diploma courses could limit your growth. What's your perspective on that?
It is not at all true. Diploma, yes. I would say it is a hard truth that 3 year DNB degree or a 3 year MD and MS degree is better rather than diploma. Once and for all, in 3 years, you're getting that degree. In 2 years, you're getting a title of diploma. It is true, but you have options of secondary DNB, fellowships. There are n number of options ahead. I agree. The DNB person will, or the MDMS person will cover his degree in 3 years, and me being a diploma will need 4 years. 2 years of diploma and 2 years of secondary DNB. But I should, like, what we should say is, does that 1 year matter that I should waste and I should not look to this branch? No. Diploma has much more opportunities, and doing 2 year diploma in a good institute will help you. And doing ophthalmology has two parts: medical ophthalmology and surgical. It is amalgamation of both. So it gives you satisfaction of both actually. It is a medical branch and a surgical branch. So diploma is not the limitation. You can pursue your secondary DNB fellowships after that also.
That is nice to know. I mean, yes, that does make sense. Ki instead of dropping another year, people can go for diploma and later on do that, spend that extra year doing a secondary DNB.
Yes.
That does make sense actually.
You should be in that loop. Being stagnant at that place is very difficult. It seems very easy to say, like, we'll repeat, we'll take a drop. But the mental state we as a doctors go through is very difficult. You'll not be sure that right now what I have got the rank will be better next year or it will get worse.
Exactly.
Rather than being dicey about it, go for your branch and then you can achieve your secondary DNB fellowship, you can complete it.
Yes, that is a very good advice actually. Yeah. I mean, I am pretty sure ki people who would be listening to this now who are confused about diploma, this will be a mind changing advice for them. Okay, so let's cover your life as a diploma ophthalmology resident. Tell us, what does your typical day look like?
Okay, so we do have 3 lectures, 3 classes, I would say, which covers our clinical case presentations, journal club, and seminar in a week. We have 3 classes. It will take place 9 to 10. If they are not there, by 9 our OPD starts. So 9 to 4 o'clock, there's OPD. 4 to 5:30, we do the pre-op workup of patients which are recruited for surgery. And by 6 surgery starts. 5 o'clock the surgery starts, and the number of patients are there, depends on that we'll be free, but it's never that we are free before 8.
Okay.
And at evening or at night there is there is a duty of a resident to go in a ward and check all the patients. So this is what my schedule looks like.
How much hands-on or surgical exposure do you get during the course?
So, as a first year resident, I would like to tell you that I get basic procedures over here, like incision and curettage of chalazion, pterygium excision, sutures, some in between steps of SICS and DCR. So, these are the basic steps you get in first year. This is the exposure which I get over here. Rather than that, you can get to assist n number of cases like retina, cornea, n number.
How is the balance between academics, clinical work, and like skill development?
So yes, that is what I was talking about. Yes, it is said that ophtha is all about cataract and it is bread and butter of an ophthalmologist. I agree. But That is one part of ophthalmology. The academics which you learn in post graduation, and mind you, the literature which you have in ophthalmology is far more. It seems that it is such a small organ, but it is inversely proportional to its literature.
Okay. So when we discussed about this session, you had told ki you will be having a health camp today, earlier
Yeah.
in the day. So could you tell me how was it like? What do you do in the health camp, and how was your experience?
So basically, our institute has a camp every week. Once a week,
Uh-huh.
there is a camp. So you go, you see the patient, you diagnose, you recruit the patients, and then you assist for the surgery. So it is
Okay.
basically, it starts from, it depends on what location your camp is. It is on different places. So today, my camp was 50 kilometers away from here. So we went there, we had OPD till 4 o'clock. Then after that, woke up and then OT.
Okay, so you do day surgeries in the health camp, no?
Day surgeries means what do you mean?
As in just the short surgeries. I mean, I would say ki like the same day you saw the patient, you did OT and you can discharge the patient same day. That kind of.
Ophtha is basically the surgery which takes place in Ophtha. The recovery period would not be like the patient will not be admitted more than 1 day in your ward. Whatever your surgery is, the patient won't be needed to be admitted in your ward for more than 1 day.
Okay, so like you guys don't even have night duties in the wards also, right?
It's it depends what patients do we have. We have to take
Uh-huh.
rounds at night. Right now, we are not having any ward duty, but whenever the nursing staff calls us for any pain, like in any eye pain, ocular pain, whatever symptoms does the patient have or complain, if a patient is complaining, we have to go down and see.
Okay, so is it like in MS ophthalm also, or is it just in diploma?
No, it's not related to my degree. It is
In
ophthalmology.
ophthalmology, no one has night duty even in wards. They stay on call.
Yes, huh.
Okay, okay.
This is ophthalmology I'm talking about. This is not related to diploma, MS, MD. This is not related to degree.
Okay.
It is related to the branch.
Okay, nice. So, what has been your favorite aspect of ophthalmology so far? Clinical cases, surgeries, या फिर patient interaction?
So I would say treating a patient for his vision, it is very praising and it is very fascinating that this small structure in our body, like I get to know, like as a fresh new beginner in ophthalmology, I get to know every day I get to know some new things. And every day I'm overwhelmed. These many things are taking place in this small organ. So this is very fascinating for me. Of course, all the clinical cases and the rare ones which I get to see here are to get fascinated by it.
One more thing, like the stipend that you get in during your diploma ophthalmology residency, is it at par with MS stipends or like कोई difference?
So it depends. There is no difference between diploma ophthalmology and a DNB stipend. But I have no idea about the difference in MS and DNB. But it will be equally paid as equal to a primary DNB student.
Okay, sure. So, moving on, what are the main career pathways available after this course?
Okay. So as I have already said, after diploma DNB, you have option of secondary DNB, or you can go directly for fellowship. But many renowned institute prefer the primary DNB and the MS students first. They get the priority for fellowship. The diploma student will not get a priority over there while getting selected for fellowship. So it is better
Okay.
go for secondary DNB and then go for fellowship. And what I think is ophthalmology will not be completed in 2 years. You need those 4 years to understand the core ophthalmology and then do your fellowship to get specialized in ophthalmology. It comes in cons of ophthalmology that it has a greater learning curve. It will take time, but it will be at the end, it will be fine, I guess.
Are there any super specialty options after completing your secondary DNB?
So, ophthalmology is an end branch. You will have
Okay.
to do fellowship, for example, in vitreoretina, cornea, glaucoma, pediatric ophthalmology, squint. These are the things which you'll get to do fellowships in, and then you
Okay.
specialize yourself in those spectrum.
Nice. Do you have any bond after diploma?
No, you don't have any bond after diploma, but see whether the diploma is in a medical college. If you are getting a diploma in a medical college, then do see it, because there are some colleges which have bonds. I don't have a bond over here, but there are some colleges which, especially the medical colleges. This is a DNB institute, but in the diploma which is accredited from a medical college, you should definitely check that whether do they have bond or not. I don't have a bond over here.
Okay. So what are your future plans after completing diploma? Do you want to do practice? Do you want to do secondary DNB or any further specializations?
What I have planned for is I'll go for secondary DNB and then
Okay.
for fellowship. So it is a long way to go.
Can you walk us through how the secondary DNB goes? Like how is the exam? How tough is it? Competition? Can you walk us through that?
So secondary DNB is about focusing about the institute. Where do I get the secondary DNB? And competition, I guess, is for the institute. The seats are available. As far as I know, the seats are available. But if you want to excel, get into those renowned institutes, or just inquire about it, that what amount of hands-on you are getting over there, and then get into that institute. So you'll have to go through PDCET after doing your diploma. You'll have to give PDCET, and then you'll be recruited your college.
Okay. For PDCET, do you have any platforms that helps you prepare for the exam?
As far as I am knowing, but I don't have any idea about the platform. Whatever knowledge you get and whatever their syllabus is given on the website, that you have to prepare. There is no such platform as Marrow Dams for PDCET. There are some Telegram channels. You can join them and get us like.
Nice. Tell me, how do you see the future of ophthalmology evolving with these new technologies coming, robotic surgery, AI, and everything?
Ophthalmology, from the very first day, I have come to know that it is a demanding branch. It is an expensive branch. That is what I feel. For having a private setup, you'll have every 5 years the technology will change. You'll have to keep that in mind. The technology will change. You'll have to keep yourself updated, and then you'll have to do, if you want to be in that competition, I would say, or you'll have to be with that. What I would say is, if you want to be in that competition or would be in that, I'm not getting the word, but
We understand what you're trying to say.
so you'll have to be updated, and recent technologies are very fast and they do change in ophthalmology. So do learn and keep yourself updated.
Definitely. I mean, medicine, be it any branch in medicine, is that you have to be a lifelong learner. You can never say कि हाँ अब मेरी पढ़ाई पूरी हो गई है, now I don't have to learn anything. If you have that mentality, you are bound to fail.
Yeah, that's true. But in ophthalmology, from basics, everything starts to change. So what we have learned in UG also, the SICS, like the ICC, ECC, in that also SICS, then FACO, then the things have evolved very fast.
So you have to relearn everything from the basics.
Yes.
Okay. I mean that must be very interesting. Challenging definitely, but
Yeah.
interesting as well. Okay. So what has been your biggest learning from this journey so far?
So the biggest learning I would say is never stop. Just see, are you better from yesterday? Have you grown from yesterday? Every day you'll get to learn new things if you are open and you have not closed your eyes. Just push yourself every day and you'll get to learn new things every day in ophthalmology. There is never an end. That is what I will say.
Okay. So, what advice would you want to give to MBBS students who have completed their MBBS and are confused between MD, DNB, or diploma?
See, what I have followed, I would definitely like to tell them is, do not get into that my friend is getting this branch. This branch is very nice because he is doing it, or because it is a group's choice that this branch is nice. Sit back and just think, down the lane, 10 years down, what you want from yourself, what do you expect from yourself, what work life balance you expect from yourself. And there are n number of things to do. Profession is at its place, but there are many other things to do also. So yes, it is important. Career is important. That has to have first priority in your life. But for yourself, rather than to prove for anyone else, just think for yourself first. And then just choose what is best for you, what fits for you.
Nice. That is a very good advice here. So tell me, what should realistically expect from diploma program? Its benefits, its limitations, everything.
Doing diploma is not a limitation. If your rank is giving a diploma in ophthalmology and you want to pursue ophthalmology, go for it. Do not take a drop for it. Go for diploma. Enter into ophthalmology. Enjoy your two years process in diploma. You have many opportunities ahead, like secondary DNB, then your fellowships. The learning curve will be same for ultimately everyone has to reach the same thing. Someone will need, as it is a surgical skill also, and it is a microsurgery. So stability of your hand is also important. Might be doing diploma, your hand is much more stable than a person doing MS.
Yes.
So the learning curve also depends on a student also.
I mean, this surgery में तो they do say ना कि in surgical branches you have to be like a fine art student. Your hands
Yeah.
should be very
And
stable.
in that, if you're operating in an eye, such a small organ, then think of the
Exactly.
precision which you'll be needing. The minor instability in your hand can lead to
Yeah, obviously. So, at the very least, what message would you like to give to students who are preparing for NEET PG right now?
just do not think about that. Don't give your mind that I want to do this, I expect to do this. Yes, dream big. Just don't get burdened about that. I want to achieve this rank. Just have an ambition, dream big. Just see towards it as a healthy approach and then go for it.
Obviously, I mean, that is a very genuine advice. You have to have a vision before appearing for NEET PG. And at this point, I feel like कि during my NEET PG counseling, na, if anyone would have advised me, probably I would have also gone for a diploma compared to what I am doing right. I was also confused at that time, but I won't say कि I'm not liking my paraclinical journey. Pharmacology is a very good branch, and I do have very good aspects in the future. But I was not very confident during the counseling period.
Okay.
So if I would have gotten an advice that time, maybe I would have changed my decision. Abhi, where I am, knowing what I know right now, I would have not gone for diploma. I would have definitely chosen pharmacology that at that time as well. But this diploma advice, I feel like many students would benefit from this. Okay, so let's have one inspiration zone. Okay, so what is a quote or mantra you live by as a doctor?
Just dream big and excel in
Right.
what you're doing.
Okay. One advice you would give your first year MBBS self.
Enjoy your 5 years of MBBS.
Right. The best thing about being an ophthalmologist.
I can look into people's eye without any hesitation.
Okay, a misconception about the diploma course you would like to burst in one line.
It has n number of opportunities.
And finally, if you had to describe your journey from MBBS to diploma in 3 words, what would they be?
Fun, it's a dream come true, and excellence.
So thank you, Dr. Ratnali. That was very brilliant. Obviously, you have chosen the path. Many of the NEET PG aspirants are hesitant to go through that. People do choose diploma in pediatrics, child and maternal health care. They do choose diploma in like OBG, but diploma in ophthalmology and diploma in ENT is not very mainstream, I would say. But at least I personally have not heard many people doing diploma in ophthalmology and ENT. Obviously, there are people out there doing that. You are doing that. So I feel like this session is going to benefit a lot of people. Lot of aspirants will be watching this and who are confused about the paraclinical branch, and they might be feeling like there is no other option apart from the paraclinical branch. So this is going to definitely help them. Thank you so much, Dr. Ratnali. Thank you once again.
Thank you for having me.
Well, that was a truly enlightening conversation with Dr. Ratnali Gandhi, reminding us that success in medicine is not just about the rank you get, but how you make use of the opportunities that come your way. From NEET PG decisions to college selections and to real world training in ophthalmology, her journey shows us that passion and persistence can shape any career path into something meaningful. If you found this episode valuable, share it with someone who is preparing for NEET PG or exploring diploma options. You can find more inspiring medical journeys on our DecodeMD YouTube channel as well as Instagram page. So like, share and subscribe.